All right. Good afternoon, everyone. I am Chris Sorchik. I am the Executive Director with Capital Area Healthy Start Coalition. Thank you for joining us today for part 4 of our Preconception Health Lunch and Learn series. Through our coalition's community needs assessment that was completed in 2020, we recognize that poor preconception health and health inequities are negatively affecting pregnancy and birth outcomes in our community. In our efforts to improve preconception health of women and men locally, our community has come together to provide this series of lunch and learns on topics that are related to improving preconception health. So in 2020, our FEMUR case review team reviewed 30 cases of infant and fetal deaths. In those cases, 10% of the mothers had mental health issues prior to pregnancy. According to a study completed by the University of Wisconsin, women with poor preconception mental health had 40% higher odds of having pregnancy complications than women without such problems. In today's presentation, we're going to learn more about how mental health plays a part in preconception health. If you have any questions during the presentation, please put those in the chat box and we will answer those at the end of today's presentation. I would like you to now please join me in welcoming our presenter, Ms. Lola Brognano. Lola is a licensed clinical social worker specializing in providing mental health counseling to women during and after pregnancy. She is certified in perinatal mental health. She is a level 2 birth trauma therapist and a certified pregnancy and infant loss advocate. Lola centers her practice around health and wellness approaches with perinatal mood and anxiety disorders, infertility, pregnancy loss and grief, and reproductive health trauma and violence. Welcome and thank you for being with us today, Lola.
Thank you, Chris. It is wonderful to be here. I always absolutely love anytime I'm able to come to the community and kind of have conversation about some things that we are all passionate about. I'd like to start by saying my name is Lola Brognano. I am in private practice here in Tallahassee, Florida. And as Chris said, I mostly focus on maternal mental health and wellness. And I just want to thank Chris and the coalition for hosting today. This is a really important topic, and in essence of time, we're gonna go right in. And despite what we're talking about today, there's very little direct research about mental health specifically and preconception. And so what we are doing in the field is really kind of piecing it together by what we know down the line. We know many things down the line, and when you bring it back this way, we're starting to see where it wasn't just postpartum like we thought. We started realizing it was also pregnancy that things were happening. And now we realize actually preconception phase is just as important. It's part of the reproductive span. So we are going to go ahead and get started. Thank you for introducing me. A little disclaimer here, as we're talking through today, we are not, of course, giving any kind of medical advice. It's always wise to check with your PCP, primary care physician, or your OBGYN for any sort of exercise, medicine, regimen of any kind, including supplements. And I really want to point out today that throughout this talk, I'm going to be using the term women, and that is going to be used in reference to birthing persons. And that is because the majority of research has been completed on cis women. However, it should be known that these findings these findings can apply to any gestating person, and more research is needed in diverse and marginalized populations. Today, we're going to have a little bit of some objectives. We're going to learn what is preconception, what is the relation to birth outcomes, relation to increased perinatal mood and anxiety disorders, and kind of define what conscious consent is and conscious conception. We're going to talk about what the protective factors of those things are. So today, okay, what is preconception health? It is the woman's health before she becomes pregnant. It's knowing the risk factors, health conditions, things that may affect the mother and the unborn child. And it's defined as individualized care that's focused on reducing maternal and fetal morbidity. And that is a lot of what we're talking about is the outcomes, and increasing the chances of conception when pregnancy is desired, okay? And it really is a set of interventions that aim to identify and modify biomedical, behavioral, social risks, all of those things that really are factors in a woman's health and their pregnancy outcome. And that is through prevention and management. And so why is preconception health important? It's definitely important today with what we're talking about because it relates to birth outcomes, which relates to a person's postpartum. And so it's increasingly recognized that the preconception period is a window of opportunity to intervene and to improve those outcomes for women and for the next generation, because those of us who work in this are working for healthy families as well. And as we know, right, like a healthy mom is a healthy baby, is a healthy family, is a healthy community. And the importance of mental health specifically and comorbidity problems, they have not traditionally been taken into account by policymakers and mental health service providers. And so the more we learn about this and the more we bring it into conversation about how important this is, we may have better legislation, we may have increased social programs available, more trainings for mental health providers, paraprofessionals. By addressing preconception, physical and mental health, medical professionals can improve the health outcomes across the whole life course. And that's what we're focusing on today. That period, the preconception period, represents an opportunity to intervene, okay, and improve those outcomes. So some of the ways that can affect, right, kind of desired outcomes, and we used to say poor outcomes, we're trying to kind of move to, non-desired outcomes, but typically, historically referred to as poor outcomes. And some of those are social determinants. And depending on someone's, scale on here, it can really determine a lot of things. And as we know, it kind of goes down generationally through families and stuff. And if we have poor social determinants, we're likely going to have poor outcomes. And it goes down to generational trauma, generational poverty, and all those things. And so some of those things that we can see here is access to healthcare. If we have regular access to healthcare, we all know what that means. We're likely to have better health outcomes. We're likely to have more likelihood to be able to manage our symptoms and our health with good medications, housing and income, economic stability, sanitary living conditions, access to clean water. I added that myself because in America, you would think that that might not should be a thing, but we know that there's a state that has some problems with access to clean water. And that is a factor in whether or not that affects someone's health and their risk outcomes. So we have a lot of things, especially when you start getting into neighborhood and environment and social community. We have things like exposure to violence and crime and drug activity. And I don't know if any of y'all are aware of the ACEs, the Adverse Childhood, events rating, but a lot of these are on there. And so we can kind of see how a lot of these things can be connected. And some of the effects of social determinants when it comes to what we're talking about is prenatal health and status are influenced by those multiple environmental and social factors. All of those things, exposure to chronic stress, chronic stress is what we in the field believe to be that big glass ball that we're trying to hold that can really kind of shatter everything around it if a mother's mental health, woman's mental health is not held. So a mother's health status directly influences her risk of pregnancy complications. And we know that maternal mental health complications are the #1 pregnancy complication. It moves right into pregnancy and postpartum. And with those things, a woman's ability to care for her child, to care for her family. And it does have direct relations to the offspring's cognitive and physical development. During the past 10 years, research has linked that maternal prenatal stress, okay, so preconception, so stress, depression, and anxiety do lead to poor birth outcomes. And poor birth outcomes relate to other things down the road. So today we're going to talk about, in the little time that we do have, how social determinants and how where we are in society, the impact of mental health, social determinants have on minorities. And when we don't have proper preconception medical, prenatal care, or mental health. So PMAX stands for perinatal mood and anxiety disorders. And we say perinatal now because, as we know, it's not just postpartum anymore, it is during pregnancy. And perinatal actually means inclusive of the time right before pregnancy, and then after. And so perinatal is inclusive of preconception. And so what we're finding is that the impact on minorities is that perinatal mood and anxiety disorders are more likely to occur in women of color. They are twice as likely to experience depressive symptoms than white women. Researchers have suggested as many as 50% of women with PPD, which is postpartum depression, do not report it. We could spend a whole day on why that is, but again, the social construct is there's no space for maternal mental health complications. Anecdotal evidence suggests that Black women may avoid talking about their depression due to feelings of embarrassment, shame, and fear of discriminatory attitudes due to racial stigma. Studies have found that there's troubling racial and ethnic disparities in receiving mental health care for postpartum depression. Only 15% of all maternal mental health cases are treated. Only 15% of them are treated. And with Black women being 57% less likely to start treatment. Okay, so that is a very small number compared to their white counterparts. It's been found that maternal mortality rates among non-Hispanic Black women is 3.5 times more than non-Hispanic white women. And I'm not sure if anybody just saw recently that there was a historic case, I believe Kira Johnson is a Black woman who needlessly and preventively could have not died from a routine C-section that has been found, which we've known to be systemic racism. And due to some recent changes in the law that you can sue for a certain amount of money for things beyond just negligence, emotional damage, that her widow, the husband that was left behind with her 2 sons that she already had, was now able to landmark, be able to have some kind of justice for some of the things that we are talking about today, how she, due to systemic racism, was 3.5 times more likely to die giving birth. Some studies that we have found is that babies are more likely to have low birth weight if their mother has depression in pregnancy. Again, right? If we are not getting the care that we need preconception, it moves right into pregnancy. Untreated mental illness can affect the baby's development later on. We had a recent study conducted in California, and they do a lot of research. They found that the cost for untreated perinatal mood and anxiety is $2.3 billion. Now, that was in 2017. That is not in context to COVID, where we know that there was a huge spike in maternal mental health issues due to all of the things that we could talk about for the next 20 years. But in this specific presentation today, some of those things that are included in that people don't know, right? The untreated cost, okay? Some of those untreated costs are mothers being so suicidal that they have to be hospitalized, okay? That is a cost to the system. It's a lot of those kinds of unintended consequences that come from poor maternal mental health. And here are some statistics that I wanted to bring in that I thought were pretty interesting, so that we can kind of, bring it into local and how, in our backyard, we kind of take attention. And so in the Big Bend area, we have a population of 13,000 plus those who identify as women. And so that, if we use the international number of, there will be 1 in 5 birthing individuals who experience a perinatal mood or anxiety disorder, that leaves us in the Big Bend area with about 2,600 at risk, 2,600 women at risk. The Tallahassee population, we have 102,000. So the risk of that, with 1 in 5 being 23,000, okay? So internationally, 1 out of 5. PMAX are the most common complication of childbirth. And if you can see in our pie chart that, I can't believe I used a pie chart. I didn't think that was actually useful. I swore it when I was in math school that this wasn't ever going to be used. I don't need to learn this. Here it is. Big Bend population, 20%, okay, is there. And then who's at risk is the 80%, the people who are not getting the treatment. So poor conception health is very much what we're talking about today, and how it can lead to poor outcomes, poor birthing outcomes. It has correlations. And so women who have depression during pregnancy may have trouble taking care of themselves, right? They may not be able to eat so well. They might not be motivated to attend prenatal care checkups, get enough rest. Sleep is a big one. If someone took antidepressants before pregnancy, they may have become depressed again if they stop taking them. Medication is something that deserves its own space when it comes to whether or not that is something that women should consider stopping before, staying on what they are. When they are pregnant, the same things, postpartum, the same considerations. But we do know either way, whether a woman decides to have medication in any of those periods, there is risk for that. And we do know that there is risk when a woman is not treating her mental illness. And we do know that there is risk for outcomes for that too. So there is correlations of whether or not a woman is on or stops taking them. But we do know that having untreated depression during pregnancy raises the risk of postpartum depression. Depression during pregnancy has been linked to several problems. You can go into labor too early. And so we have poor outcomes here, poor birthing outcomes. Baby could have low birth weight. There could be health complications for the baby after the birth. When depression isn't treated during pregnancy, it can increase the risk of problems for your child. They cry more, they have evidence of, harder to comfort, harder to soothe, a lot of emotional distress that seems to have a hard time managing. And we do know that older children may have more emotional and behavioral problems. And again, that comes into that ACEs score again. We are learning it's not just post-birth. It does start in utero, and we're learning that more and more. And now we're learning more and more it starts in preconception. And so today I wanted to talk a little bit about kind of an emerging innovative concept, movement, if you will. Conscious conception. Conscious conception is a period of consciously preparing your body for receptivity on a mental, physical, and emotional, spiritual level. Okay, so it's kind of, right, having the empowerment to try to have holistic, intentional, consciously preparing for this. So it's a holistic path of preparing your body, mind, spirit, your lifestyle, your home. It's also what happens within your home, the responsibilities of parenting and household equity. That plays a huge part into mental status, into our stress, all of that cortisol that gets put into our body, which has negative effects. So protective factors, okay, that we can put into play that gives us that conscious, intentional decision about having a desired conception period is protective factors that are conditions or attributes in individuals, families, and communities that promote the health and well-being of children and families. And some of the ways that we can do that, right? Some protective factors, okay, that do play a part in someone's mental health. And if we're doing holistic approaches, mental health is part of medical, spiritual. They absolutely are related. So we want to have sexual health, right? Factors that are protective factors. So we want to keep up with our sexual health, have routine STI screenings, consider family planning. What is going to be our birth control decisions? And especially important to have our pelvics. Nutrition factors are a big part of this as well. Some of the things we do know, avoiding caffeine, high mercury fishes. These are all things that make us more healthy in a physical way. We want, right, to take our sugar into consideration. It has direct relations onto how our medical system is working, whether or not we could be at risk for diabetes, metabolic syndromes, which do play a factor on someone's mental health. If they are on bed rest because they have severe preeclampsia and diabetes and things, someone's mental health gets affected by that. Their sense of self, their sense of who are they if they can't even do this, if they can't even get their body to do what it needs to do. That moves into the next reproductive stage. Okay. Prenatal vitamins, supplements, these are very important, right? Daily prenatal, talk to your doctor, find out what they are. Folic acid, iron, big ones, okay? Find out what's right for you. Prenatal vitamins can actually been found to reduce nausea and vomiting. That's great, Numerous studies have shown that the use of prenatal vitamins can prevent up to 50 to 70% of neural tube defects. And these are very much a part of, again, the reproductive span that a woman is in. Later down the road, possible things, for example, such as neural tube defects could affect how a pregnancy is down the road. And it very much plays into the political climate that we are in today, women's bodies and their choices being a political warfare ground. And so when it comes to terminations for medical reasons, some of these things that we're talking about today would fall into that. Sleep hygiene is a big yes. One of the things we find, whether it is perinatal mood and anxiety disorder, or it's the baby blues, which is what happens to 80 to 82% of women the first 1 to 3 weeks after birth. It is part of the natural hormonal shifts that's happening that has to do with transitioning to motherhood, the fourth trimester, and those things on their own decrease, okay? However, one of the things we see when it starts to become an actual maternal mental health complication is sleep deprivation. So we want good sleep hygiene. And who doesn't love sleep? Okay, so a study conducted identified the link between sleep disturbance and an increased risk of many things, some being behavioral, hormonal, okay, metabolic levels. More studies, right? That participants who were unemployed reported high prevalence of poor sleep quality. And although it might not have said why, one reason would be, I would say, stress. That person is probably very stressed about their current position of being unemployed, and they're having trouble sleeping. They might be depressed, and that has trouble sleeping. If that person is pregnant, right? There we go. So one right there before I went on was an analysis of birth records found that 3rd trimester poor sleepers were more likely to have vacuum-assisted deliveries. And as we know, medically assisted deliveries are more likely to have complications and sometimes mortality complications. I apologize if there's any connection issues, suddenly huge storm over here, so we'll just keep going. Next important thing on here is movement and poses. Serves way many good outcomes for so many reasons. All of the systems get up and moving. Everything's kind of on alert, mind, body, and soul. Eastern medicine, from the beginning of time, before Western medicine, knew that the life source, the chi, had to be aligned, and the way for that was always mind, body, and soul. We have to have some kind of movement, exercise in our life. We do not have to be, okay, on the football team, stretching, yoga, movement. So the American College of Obstetricians and Gynecologists, which we call ACOG, okay, they said that women should participate in 150 minutes of moderate intensity activity a week. And that sounds crazy to me, 150 minutes, no thanks, I'm checked out already. But apparently, if you use math and you break it down, it can be achieved into your day in just a small matter of minutes a day. But here are some benefits of the physical activity, right? Is it does help prevent some of those medical things that we also want to keep in check, right? Certain cardiovascular diseases. It helps control weight. One of the things that I like to see on here, though, is that it does relieve stress. It does improve sleep quality, and it helps with depressive and anxiety depressions. And those are mental health things that are the perfect storm that can really kind of tip someone into that, poor outcome category. Increased energy. When we have increased energy, our cognition changes. We're probably not as likely to be as irritable. Our worldview changes. We feel motivated. We probably get a little bit more done, But again, we come back to fewer complications in delivery. There's that connection, right? some other things, some things we know, some things we always want to continue to talk about. All right. The CDC and ACOG recommends, right, that we completely avoid alcohol. Okay. We all know during, okay, and they are encouraging preconception as well at this point. Prenatal exposure can result in various neurobehavioral impairments, developmental and physical abnormalities. And that was in 2018. This isn't from the 40s. We know this to be true. Alcohol exposed offspring and children experience poor sleep quality and definitely behavioral issues. Nicotine. Okay, they have those labels on there. They couldn't lie to us about what happens with nicotine anymore. Okay, we know that. There can be abnormal bleeding during pregnancy, which can be dangerous for mom and baby. And the thing about this, though, is part of the actual birthing outcome that we're talking about is whether or not there are life-threatening complications, because that can become birth trauma. And birth trauma is definitely something that leads to risk factors of postpartum mood and anxiety disorders, as well as postpartum traumatic stress syndrome. Smoking raises your baby's risk for birth defects. Marijuana use. This is a little touchy, and I'm not going to go into it. The research, and this is not a political thing, the research on medical marijuana has ample evidence for decades on the benefits for adults with adult brains. The evidence is not as supportive for non-formed, non-adult brains. So as of right now, what we do know is that the risks of stillborn for substance use is greater in pregnancy. With tobacco, 1.8 to 2.8 times greater risk of stillbirth. Marijuana, 2.3 times greater risk of stillbirth. And passive exposure to tobacco is on there now. Passive exposure. Being in a car with someone, they're saying even now, third hand smoking, which is hugging someone who has just had a cigarette. It's now on your clothes, it's probably in your hair, and then maybe we're holding baby. Okay, so passive exposure from the beginning down. So another protective factor for our conscious conception, ways to improve our outcomes, is self-cares. And we talk about that, and that is not just a big who word now, it really is a thing. And it's not just the surface, that's important. Surface self-care is getting our nails done, the things that we personally love in that way. Those are important, but so's the underneath stuff, right? Those are things like setting boundaries, going to the dentist every 6 months, right? That's hard to do, but that is self-cares. But some of the ones that we know to be very, very successful are engaging in hobbies, meditating, things that bring us back to being grounded and calm. Gardening, affirmations, music. Music is considered the universal language. The reason it's considered that is because that even in the most isolated native colonies that they have found that do not have spoken language, they do have music and dancing and ritual. And so that's what they say is the universal language. Energy replenishing things, activities, hot baths, pamperings, First Fridays. These are some other types of self-care. As we know, physical, walking, yoga, resting, sleep hygiene, emotional, some things we've talked about, but there's a couple of other things on there. Forgiveness. Ooh, why is that on there? Ooh, that can sit around and take space, negative space. There's some social stuff. Boundaries, boom. No, I don't want to go today. I would be too stressed. I'm going to sit here and I'm going to do my garden instead because I'm taking care of me. Spiritual. Do you have a sacred space? No, that's a good one. There's some other stuff, self-care during pregnancy. These are really important, okay? And they're very individual. One big one, don't compare yourself. Comparison is the thief of joy. And I personally like to say, right? The biggest Instagram filter is the mom filter, right? Everything's perfect. The mom filter. When we know, we just learned today that 80% of maternal mental health is untreated. It's not possible. The mom filter is real. Some more ways of protective factors are formal and informal support systems. We know that just as much as we have found sleep to be, okay, one of the biggest factors to determine which way we're going to go. We found that support system is right in there too. That is so important. We found, right, that doulas can be extremely beneficial, okay? They help with the physical, mental, emotional support that parents have. Every kind of doula there is. Every kind, and that includes abortion doulas and death doulas, because that is a part of the reproductive lifespan. Doulas have research that shows that doula support women have lower odds of cesareans, especially doula support when they were prevalent among Black women. Okay, why would that be? Comes back to some of those social determinants. Parenting classes, very much an informal support system. It can absolutely help. Studies show it helps parent confident, reduces that stress, that depression, that anxiety, okay? And it can help with bonding, which we very much know, again, down the road, pregnancy and postpartum, a woman very much reports whether or not, if they are receiving enough emotional support from their partner, absolutely is a factor in determining whether or not she views whether or not she is feeling right. Some other stuff are support groups, mom groups. They have been found to be very helpful. They do decrease stress and maternal mental health complications, perinatal mood and anxiety, while strengthening relationships among family and peers. Social support is the greatest resource for reducing stress during pregnancy. In 2022, it was found that social support is the greatest resource for reducing stress during pregnancy, okay? And so that's how we tie in from the beginning, that if we start setting these protective factors in place, that when we make our conscious conception decision, that if we set up our things, our social support, okay, that we are going to be able to reduce our risk factors. So one of the things we also want to do is talk about preparing for pregnancy with intention, okay? We want to say birth expectations. We talk to so many women, and when we ask them after their birth, how did it go? You know, they were like, it was awful. And then you ask, well, what happened? And they say all these, and you ask them, well, what did you expect for your birth? What did you actually want? And sometimes when you ask that, they didn't think about that. And that's why we try to separate out what are your birth expectations and what are your birth plans. Birth plans are the semanticals. Do you want to have a natural birth? And we say natural birth, that means all birthing. Now, not just vaginal. All birthing is natural. Just some of them have different interventions. Okay. Do you want to be in the hospital? What is your environment desires? Okay. Those are the semantic part of the plan. But we darn well want to be prepared for expectations, because that plays a part in how we view whether or not we had birth trauma. which is a risk factor down the road for postpartum depression and PTSD. Okay, want to talk a little bit real quickly about the importance of consent and shared decision-making to avoid birth trauma and PMAX. When a woman feels bullied, yelled at, is told she can't birth that way, is held down, people are making decisions for her, she doesn't feel like she has a voice, she didn't know she couldn't say no to 20 residents coming in and shining lights on her exposed nakedness and not giving consent for a membrane sweep. Those are violations. Those are considered when it comes to certain non-consented procedures, that those are considered what we call obstetric violence. And that absolutely plays a part in maternal mental health. So professional treatment, of course, is one of the ways that we can keep our mental health in check. Ask for help, okay? Talk to your pastor, talk to your friends, okay? Medication is considered one of the possibilities, okay? There are benefits to that. And if you talk to a reproductive or perinatal psychiatrist, you are going to get the most accurate, up-to-date information, whereas an OBGYN or even your primary care physician is most likely going to have the outdated information, the wrong information, or is going to be very apprehensive about starting medication and very quick to take you off medication you might be on, despite it might be what you need. Some local resources here, okay, that we have that I wanted to identify real quick. Okay, some of you know, okay, that we can get conception, preconception, pregnancy, postpartum health. Sister Friends is one that I added on here because it very much goes into the support systems, especially our BIPOC community here. That again, the more village that we support, the more likely our outcomes are going to be desired. Okay, and here we are. I believe hopefully enough time that that we can get some questions. Again, I will say here that although there's not a lot of direct research, it's new and it's starting, and the way that we are doing it is by knowing the information we know now and going back and starting studies there, specifically looking at how is a woman taking care of her mental health in this stage, enough of it so that we can absolutely come back to having different lunch and learn presentations with much more research saying, and this is how we can guarantee or lower our risks of poor outcomes. But that is the end of the presentation, and I will just have, I guess, Simone, let me know where we're at with that.
I do not see any questions within the actual chat, but if anyone feels free to open up their mic and ask a question or put it in the chat and I can read it out. Fran Close says, excellent presentation.
Thank you. Thank you very much. It's a pleasure to be here today.
I learned a lot. I did. I thank you, Simone, for letting me come off mic. There's some terminology that you use, Lola, that now I know. And I appreciate you giving us some knowledge about the terminology when it comes to some of the things, because I didn't know there was obstetric trauma. Yeah. And so that was one of the terms that I do appreciate you explaining to us. Very nice. I really enjoyed it.
Thank you, Fran. That's a newer term, and it's certainly it can be, depending on who you talk to, there might not be a lot of space in if you're talking in the medical space, there's not necessarily a lot of space there yet for it, but because birthing itself is very much seen more about the medical intervention side and their convenience of it. And so a lot of times it's viewed as part of birthing, that if a doctor comes in and is like, you've been, in labor too long, well, the only way I want to handle this, I don't care how you want to handle this. I'm not even going to ask. Shared decision making. I'm not going to ask. I'm just going to do a membrane sweep. We now term that to be obstetric violence, because that was unconsented. And if it's taken out of context of birthing, where suddenly consent doesn't matter at all. If we think about it, consent doesn't matter. Someone can just come in and say, okay, and make someone feel that they don't have a choice to say, even under any circumstance, that their answer is no, that they do not have bodily autonomy. And so shared decision-making for everything is important, especially when we are trying to reduce birth trauma, which can come off of obstetric violence, but it can be reignited in the birthing room when someone perhaps had previous sexual assault and they are a survivor of that. And suddenly they're in the birthing room and 20 residents come in and do not ask if they can be in there. And they become a little upset, a little agitated. And one of the nurses who's annoyed because they've been birthing in there and they weren't able to leave their shift. Mind you, nurses are overworked just like everybody else, but we know that everyone in the room, everyone plays a part in how that birthing process goes. And so it starts everywhere, and that's a whole nother conversation. Okay, but someone who's had previous assault, previous trauma can get re-traumatized in the birthing room when their consent is taken away, and something that may seem simple to somebody else, such as holding someone's legs down when they don't want to birth in that position, can be viewed as assault because they didn't want to.
Yeah.
And
Oh,
that is
wow, Lola, that's, I didn't even think about the sexual violence part of that.
Yeah.
I was thinking about like the membrane suite, the things that you just mentioned, but to just think about just those positioning and touching could be viewed as, it bring back bad memories of an assault. So, oh my gosh, that's really good. I mean, good that I know that now and can
Yes.
pass that language along. So thank you so much.
Yes. And so when that happens to a person, they're going to come out of there. That birth outcome is likely not going to be well for them. And it's going to transition into the 4th trimester. It's going to transition into the ACEs scores. And so what's important for us to know all of this holistically, preconception, pregnancy, postpartum, is so that the right people in the entry points know what to do and where for them to go to get help, right? Yeah.
All right, we got a lot of thank yous. I did want to ask this one question because I know you touched on it earlier, but can you also explain some signs women have a perinatal mood disorder, and how do you know the difference between that and baby blues?
Sure. Yeah, that's a great question, because that's one of the biggest and one we need to know. Okay, so the baby blues are, it's expected actually, okay, because it's considered a natural transition from I'm pregnant 1 minute literally, and then I'm not the next. Okay, and what comes with that? The transition of motherhood, which we now call matrescence. Okay, that whole transition of not just baby's born, but a mom is born that day. Okay, and so the baby blues is very much a time frame of symptoms. Okay, and what those are can be sadness, crying, sleep deprivation, moodiness, changes in appetite. Okay, things that would happen if someone's adjusting to something, right? And mind you, the hormonal part is there. We know that that is absolutely a part of this, okay? And we want to take it out of the whole hormonal, no. When we're talking literally about when it comes to mental health, the hormonal part is a part of this, okay? The difference between the baby blues, which is about 80% of birthing individuals have for the time that they have it, which is about 1 to 2 weeks, 3 maybe being the most, okay? Is that it's how long those symptoms last and how severe they are is what determines whether or not it moves into postpartum mood or anxiety disorders, okay? Because these, the baby blues, we expect organically without intervention to dissipate, okay? To on their own kind of go back to the baseline craziness that it's going to be, okay? The baseline heavy hardness this is going to be. But the difference being is that it's not causing quality of life to drastically decline. It is not causing global functioning to be impaired. That's what starts happening when it's a postpartum mood or anxiety disorder. We actually start to see it starts to increase. It starts to become more concerning. The sleep doesn't get better. The mood fluctuations become worse. The depression or anxiety starts to become worse and consumptive, sometimes debilitating, where their mother cannot care for her baby or herself. If the depression is so untreated and that bad, we know the horror stories. We know that maternal and mental health complications are the #1 complication, and that maternal suicide and substance use are the #1 preventable maternal deaths. Those maternal mental health issues are a part of that, right? And so we do want to know the difference. And once we are into the postpartum mood or anxiety, we absolutely want to think about these protective factors we talked about today. Can we find you a mom group? Can we find you professional help? Can we find you a new hobby? Right? Are there moms in your neighborhood that are walking around the block, walking the strollers? Can you join in? There's a lot that we can do if we do the wraparound village mind frame that I think this movement is trying to get back to. And so typically that is where we kind of focus on the end, right? When we start to see the poor outcomes and how it's starting to cause a woman and the family to start to spiral and decompensate.
Perfect, thank you. Dr. B asked, what are your recommendations for men or partners to engage in birthing plans, expectation conversations? Also, do you have any suggestions for tracking fertility apps or methods?
For the last question, I do not. And that is definitely something that is actually individualized, and you would want to probably be with a fertility specialist if that's what you're trying to track. To the first question, Dr. B, partners and dads, is that a lot of people don't know that 1 in 10 dads also have postpartum depression, okay? And although they experience the same things, they express them differently a lot because of the social construct. They have what we have found is how they express it to be more anger and substance use and emotional disengagement. And so what we would find is to encourage locating the very few resources there are available, but they are. And one of them, if somebody could type it in, is Hand to Hold. That's at Cedars-Sinai. It is specifically a support group for dads, partners. Okay, dads and partners, of course, could possibly use their EAP that they have maybe through their employment medical benefits, that if they need to talk to someone about what they're experiencing, because men aren't necessarily given a space to talk about their mental health. Maybe they need to find a local dad support group. And hey, if there isn't one, maybe you can start one, Dr. B, right? We all have to start somewhere. And if there isn't one, we need to build one. But some of those places that you can start with that might not have something will know where to direct you, and a few of those are Postpartum Support International. Okay, there is actually a bereaved dad group there. There's a postpartum dad group there that's run through one of their dad experts. And so there's a few. Those are the two biggest ones. Oh, and I'm sorry, education-wise, to learn about planning and prevention and things, get involved in the conversation. This is not just the woman, this is you as well, and you as universal you. What are your expectations? What do you want to do? How involved do you want to be? All of this is a family affair, including pregnancy, birthing, feeding, sleeping. It's a family affair. It is not just solely the birthing person's individual responsibility. Nobody helps the mother. That is the partner's responsibility. And dads and partners are not babysitters, they are parents. And so getting involved from the beginning, parenting classes, Lamaze classes, learning about perinatal mood and anxiety disorders for her and for you, finding what your local resources are, calling your local pastors. If you're in certain communities, churches are way more the way to go to get help and answers than through the medical system. Keep those individual things in mind. And again, right, if you can't, reach out to a professional.
Great, wonderful. Thank you, Lola, for this presentation. I want to thank everybody for joining us today. We are at our time, and we will be sending out a recording of this Lunch and Learn along with our flyer for our upcoming Lunch and Learn, which will be held on June 3rd. We will be talking about specifically men's health and the role men's health plays in preconception health, because like Lola said, it's all tied together. Our presenter next time will be Ken Scarborough. So we look forward to seeing you all there. Thank you for joining us. And once again, thank you, Lola.
Thank you very much. It was wonderful being here.
Have a great afternoon, everyone.